Good morning, everybody. We're going to go ahead and get started. At 8:30, we're going to have Brian Lewis speak to us about the Social Security benefits. He is backing up Russ Russell, who, with the impending shutdown, had to cancel last Friday, and so Brian Lewis graciously agreed to speak on the Social Security benefit. And then at 9 o'clock, we'll hear from Carrie Davidson, who will talk to us about health and wellness. And then we'll break at about 9:10. And then we'll come back at 9:30 and hear from our retirement specialist. So first, let me introduce Brian. Brian is a wealth management financial advisor with CapTrust. He's held several positions with CapTrust since he joined the firm in 2013. In his current role, he offers advice and wellness, and he works with retirement plan participants and their families. Prior to joining the firm, Brian served as a retirement plan consultant at Actuarial Benefits and Design Company, worked in the industry since 1997. Brian aims to provide quality service, offering clients a clear overview with their retirement plan as well as the steps necessary to reach their goals. When not helping clients achieve their retirement goals, Brian enjoys spending time with family, friends, working out, going to the beach, and playing golf. So with no further ado, Brian's going to come up and speak to us. And I forgot that I didn't mention that my name is Gail Carball. I've been at the university for 26 years. My name was on the registration list, and it was removed at some point, but I'm here as an attendee as well, so welcome, everybody.
Good morning. Everybody can hear me? Good morning. Yeah, I can thank our government for me being up here this morning. Well, we're going to talk a little bit about Social Security. Just like retirement, Social Security is very individualized, right? Depending on how long you worked, depending on how much money you made, whether you're married, divorced, there's a lot of factors that go into figuring out what your Social Security benefit is, when you should access that Social Security benefit. And the good part is that Social Security benefit is going to last for your lifetime. Who's turning? You turning in the back? I don't have access to it. Green button. There we go. We're going on the fly here. Just when you think about Social Security, the Social Security Retirement Administration was put into place a long time ago as a safety net, right? Cover a society that didn't save for retirement. So Social Security was created to replace income when folks retired. It wasn't put in place to cover 100% of your salary. That'd be great, right? If we could just retire, still live the way we were living while we worked. So it's just going to be a percentage of your income. Social Security benefit is kind of like a pension. Maybe your parents, your grandparents had a pension, they retired, they were going to get a monthly benefit guaranteed for the rest of their life. That's exactly what Social Security is. Once you start Social Security, you're going to receive that monthly benefit until you pass away. That benefit will increase with cost of living. That should be coming out here shortly. It's done on an annual basis. In October, November is when that cost of living basis comes out. And again, it's based on what comes from the federal government, the cost of living piece. The monthly benefit is your highest 33 years of earning average, right? A lot of us start working really, really young when you're 15, 16. Eventually those numbers fall off, right? So highest 35 years. To be eligible for that benefit, you actually need 40 credits, which is basically 10 years of working. Most folks have that 10 years of working unless maybe you got out of the workforce, you raised kids, things like that. But again, you need 40 credits or 10 years of working. And the Social Security benefits are capped based on the taxable wage base. This year, I believe it's $160,400. So anything that you make above that, you don't receive any Social Security benefits on. So as you become a higher earner, the replacement that Social Security will provide it will be reduced over time. On average, it's somewhere between 30 and 35% is what it replaces in your retirement income. Now, when will you receive these benefits? Obviously, there's a long calendar here. I'm not going to read off these different dates, but depending on the year you were born, will dictate when your full Social Security retirement benefit is, right? The good thing is, if you don't want to wait this long, you can always take an early benefit, right, at age 62. There are some pros and cons to those. We'll talk a little bit about that later in the presentation. But no, full Social Security benefits for most folks now are 65. If you're a little bit younger, you may have to wait to age 67. If you're not happy with that, you could take an early benefit, but just know you most likely will take a reduced benefit. And maybe that works out for you. I talk to folks all the time that have health issues in their family, right? Dad may live to 70, mom may live to 70, so they're like, I'm tapping out, I'm not leaving any money on the table, I want to go ahead and start accessing Social Security. So again, individualize, figure out when you want to take it. Now, does it pay to wait? Talked a little bit about early retirement benefits. Normally when you retire earlier, maybe say 65, you normally take about a 30% cut on your Social Security benefits from your full benefit. Once you hit your full benefit, for each year that you wait after that, there's normally somewhere between a 6 and 7% increase in your Social Security benefit. So if you can wait a little bit longer, it may be advantageous, right? Understanding options for married couples. How many married folks we have in here? Talk to tons and tons of married couples all the time. Normally, try to meet with them together. A husband may say, I want to retire at 65, and the wife kind of hits him real quick, nah, I don't think so. Right, you're going to keep working. So what you want to think about though is you want to have those conversations. You want to start having those conversations. When do you think you want to retire? Do you want to continue to work with professors, faculty across the country? A lot of people love what they do. I meet with the 72, 75-year-old folks all the time. They continue to work. It's their life's work, right? But is it advantageous? At least do you want to start Social Security retirement benefits? So you want to have those conversations. If you haven't started those conversations with your spouse or your partner, please do so. As you can see here, there's a little bit of statistics here. 52% of married couples and 74% of unmarried couples receive about 50% of their benefits from Social Security. So it's a healthy piece of your income when you retire. A little bit here about the impacts. Again, retiring at 62 compared to this example, which is the normal retirement age of 66, and what looks like if you wait till 72. So if my normal retirement age is 66, I'm supposed to get an assumed benefit of called $3,600, right? Say I don't want to work that long. I've had enough. I'm ready to tap out, right? Well, I can retire early at 62, but you look at there's almost a little bit over $800 difference in monthly income that I've lost if I retire early. So again, you want to kind of think about that. What makes sense? On the flip side, say I really like what I do. I'm going to push it out until age 70, where I get almost a little bit over $4,500 a month. Looks a little bit better, right? Just note that once you hit age 70, your benefit doesn't increase anymore. Doesn't matter what your income was. You may get a little bit of COLA, cost of living increase each year, but that's going to be your top benefit. Now, working while you're receiving Social Security benefits, again, this is for 2023. If you're under your full retirement age and you earn a little bit over $21,000, for every $2 over the limit, $1 is withheld. So you can pay taxes on those dollars, right? And you get a little bit of a penalty. The year that you meet full retirement, again, that earning goes up to $56,520, and for every $3 over the limit, $1 is withheld from your retirement. And then once you hit your full retirement age, there is no restrictions. You meet full retirement, you can work and make as much money as you want. No restrictions on your Social Security benefit. There's a lot of numbers on this screen. Just want you to pay attention to federal, your federal taxes, and Social Security can be taxed based on your individual circumstances, where you fall in your different tax brackets. Single filers, as you can see, if you make up to $25,000, there's zero tax on it. Married couples up to $32,000. Again, that's for 2023. There could be a benefits tax up to 50% between $25,000 and $34,000 for single, and $32,000 to $44,000 for married couples. Just want you to know that Social Security can be taxable. Some folks think that Social Security benefits are not taxable, but in certain circumstances, it can be taxable. The last piece I want to talk about is the website, ssa.gov. The website is up. It's working. If you haven't already set up an account, I would advise that you do that. Again, ssa.gov. It's a great website for a government website. It's pretty sophisticated. It has a lot of information. There's FAQs there. You can get your statement. If you haven't received a statement in years, you can actually set up the account, get a copy of your statement. That's where all your information is housed these days. If you don't have a copy of your statement, you go back to your home, start looking through your file, and if it's not there, go to ssa.gov, and you'll be able to provide that statement. That statement is going to be key to your retirement, right? You're going to have Social Security, probably a retirement plan savings, and whatever you have personally. Those three pieces, what we call a three-legged stool, is what's going to make up your retirement income. The good thing is you want to be in the green, right? We want to be positive, have extra money when you add those components together. If you're in the red, CapTrust is here to help you. We can make suggestions on, kind of some tweaks that you can make. Maybe you work a little bit longer. Maybe you even have a part-time job. Maybe you start reducing some of your expenses. But we're here to give you unbiased advice. Unbiased advice. We work with Fidelity and TIAA. Doesn't matter where your assets are. But any questions? I don't want this to be a lecture at a university. Anybody have any questions?
Can you tell us a little bit more about how the COLAs are triggered, and maybe I'm getting ahead of you, but how often I hear about them on the news, but then again, we're not sure how it works. Can you explain that a little bit?
And for folks that didn't hear, he's asking about COLA. So cost of living happens annually, right? And that's basically through the Bureau of Statistics. Those government agencies work to figure out what the COLA is, and then once those calculations are done, they're disseminated to the public.
Is it adjusted with inflation?
It's adjusted with there's a bunch of PhDs that do a lot of calculations in Washington.
Okay.
Yeah. But it's done on an annual basis, and they normally are publicized between October and November each year. And it is, I wouldn't say it's exactly what inflation is, but it's close. Have another question on me. Oh, she has a microphone.
Thank you. So the slide with the years of birth, just curious. If there's any thoughts on that last one, changing. Is there, get out your crystal ball.
Yeah, my crystal ball says right now nothing's going to change, right? Eventually it will have to change, right? Social Security is a underfunded program. We all know that. Most likely my generations a little bit younger than me will have to work longer to get a benefit. But we're going to have to do something because it's just an underfunded program. Any other questions?
Next question for
Micro-
people who retire at 62.
There's a microphone.
Yeah, if you retire at 62 and you have the receipts for 5 years, that's over about $150,000. So how long, if you wait, does it pay out if you wait and take it later? I mean, you're going to get more per month, but you've already had the $154,000 early on to do things. If you invested or are able to live, if you have a spouse that's also working. So what are the pros and cons of actually doing the early retirement and taking the money out at 62? Because it's not totally as bad as it looks if you're actually, you have the money earlier.
So you probably don't like this answer, but it depends, right? Some people want to retire early, right? Don't want to work anymore. There is a way for you to do a calculation, what we call a break-even calculation, to figure out if I retire early, you know, how much money do I need to make before I would hit to basically to break even piece, right? But nobody, the big question, and no one has this answer, is when are you going to die, right? My grandmother never had a job. She lived off my grandfather's Social Security. She just died at age 90, okay? She received Social Security benefits as soon as she could. I tell people all the time, I don't know if the Lewis family is going to get any more Social Security, how much Social Security my grandmother got, right? Because she was alive for so long and she had drew Social Security for so long. But we are able to do those calculations for you, but it is very individualized. Sometimes it makes sense to retire early. Other times it makes sense to wait. If you have longevity in your family, people live in their late 90s, you know, even 100. If you retire at 70, 72, that's still 30 years. You can make up a lot of money. So unfortunately, it really does depend. But if we had that crystal ball and we knew when we were going to pass away, we'd all figure out exactly when we should retire. Any other questions? Yes, ma'am. She has a microphone.
When it comes to the spouse benefits, you'd mentioned the husband and wife deciding when they want to retire. I've worked, so I'll be covered for my own. My husband's worked as well, so his earnings would be higher. So as a spouse, if I'm entitled to maybe a little bit more money on his record, but he doesn't want to retire and I want to retire, how does that play out?
So what you want to
And then I get a widow's benefit.
what you need to do is contact Social Security. Social Security will be able to do those calculations for you to figure out, all right, what part of your spouse's benefit are you entitled to, right? And does that make sense? If it's more and you're able to get it, then obviously you want to take it, right? But a lot of times, you know, it really just depends. If the salaries are pretty comparable, most likely your benefit is going to be better. But if your spouse's salary has been extremely high compared to yours, or you haven't worked that long, it could be advantageous for you to receive their benefit.
But if he doesn't want to retire, they say, I want to retire.
Doesn't have anything to do with him. For Social Security, excuse me. Yeah, but you have that conversation. Social Security will tell you what's available to you, how much you can take. Yes, but definitely pose that question to Social Security.
We have one question from the chat here online. It says, "Can you comment on the spousal benefit?"
I don't. Is there any more to that? I mean, other than the spousal benefit, it's available. Contact Social Security Administration, and they'll walk you through the steps to figure out. There's a couple of cases that I've had where people that are close to retirement get remarried, but somebody was divorced way back when, and they were married for 15 or 20 years. That particular spouse still has access to the first marriage. I see some people clapping in here. And again, it really just depends. Social Security have all that details and all that history in their systems, so they'll be able to tell you what's available and whose benefits you're receiving, whether it's your own, whether it's your spouse, whether it's a previous spouse. That's actually one of the good components of the system, especially people that have been together for a long period of time. Oh, we got one more.
What is the maximum spousal benefit if there's like discrepancy between the two spouses' income?
I don't know what the maximum spouses benefits are, but it's on the website. I don't have that number. I don't have that number in my head, unfortunately. I have a lot of numbers in my head, but that's not one of them, unfortunately. Sorry about that. But the website has it listed. Yes, sir.
On that next to the last slide where you showed the taxable amounts. All right, on the last one, on the married filers above 44,000, is that including the Social Security payout, or is that 44,000 outside of Social Security?
So that position, the income is based on 1/2 of your Social Security benefit plus any modified adjusted gross income. And then that's how the calculation is done. So if those two numbers are above the 44,000, right, then you could pay a little bit more in tax. And that's for 2023, right? If you're already drawing Social Security.
If there's a current spouse and an ex, is there a capped amount that's paid, or are they both paid what they're actually due?
No, there is a cap. You have an individualized capped amount, right? So they're only going to give you Social Security based on one or the other. They're not going to give you benefits on on an ex-spouse and a current spouse.
There's another
Ex-spouse.
spouse on there, another person that's entitled to receive monies. I'm receiving money. Is that gonna mess up my money?
No,
or-
ma'am.
Okay.
Everything is individualized. Yeah, it doesn't. They're not combining an ex-spouse and your Social Security benefit. Good questions, though. These are really, really good questions. Have one right here.
On that table up there, the 85% is the portion that is taxed, not the tax rate.
Correct.
Okay.
That is correct. Yeah, up to 85%. Yeah, yeah. I wouldn't be up here if that was the tax rate. Do we have any other questions? If you don't have questions or you don't want to ask those questions in the big group, I totally understand. I'm in the back. You have TIA, you have Fidelity. We're all here to assist you. We want you guys to have a great retirement.
I got one question. Is there a way to get these slides, access to these slides?
So, good question. So tomorrow, there's actually a retirement readiness webinar, okay? If you don't have time to listen to the live webinar, just register. If you register, you will get a copy of the recording. You actually get these slides will be included, but it's a full, I think there's about 35 or 40 slides, a full presentation on retirement readiness that talks about savings, your retirement plans. All these slides are included. Social Security is included. It will also provide you with some additional information from CapTrust, how to get in contact with us. So unfortunately, I think HR has these slides, but again, that presentation tomorrow will have a lot more slides than this, as well as talk about just retirement readiness in general. Another question? Got some runners here.
I'm making an assumption, and I know how assumptions are. I shouldn't make them, so I just want to make sure I'm correct.
Okay.
Since you're saying married filers on that last column, that 32,000, and then 32,044, that would be the combined income of a spouse who is receiving Social Security plus somebody that's still working.
Correct.
Okay.
Quick question that I have have you guys received emails regarding the webinar? Just want you to know, someone came by and said, we thought it was spam. I'm glad it's not spam. CapTrust is part of your benefits package. We don't have any products to sell. We just provide unbiased advice. So we want to provide you with as much information as possible so that you guys can make great decisions when it comes to your retirement planning anyway. Any more questions from the chat? Thank you.
Thanks to Brian for coming and doing this presentation on the fly. We really appreciate it. Next, we have our own Carrie Davidson. She's part of the Health and Wellness Department. She has been at UK since 2006. She holds a bachelor's degree from the University of Southern Mississippi in exercise science, a master's of divinity degree from Gardner-Webb University, and a doctorate in health and promotion from the University of Kentucky. She holds several fitness certifications and loves to help others be healthy in body, mind, and soul, and she's up here to prove that right now.
Good morning, I'm Carrie Davidson. I want to talk to you about a different currency. Instead of your currency that's exchanging hands, I want to talk to you about your energy currency. And a different journey. You're ending one journey, but that doesn't mean you're ending all of your journeys. Some of them are just beginning. And so I have pulled up for you here our website for all things physical activity related. And I just want to go over a few of these things with you. So just because you are retiring does not mean that you can no longer participate in our fitness activities, either on campus, across the state, or virtually, any way that you want to do that. I'm going to start by telling you about our 3 fitness memberships. So there is our regular MoveWell membership. It's $9 a month. It gives you access to 2 on-campus facilities. So if you are going to be around the Lexington area, it's the best deal in town. It is only for employees and their spouses, retirees and their spouses. So you're not working out with students. If you are ready to leave those groups behind, then you're not working out with students at all. And if you were to click on that middle button, I don't want you to click it, but if you were to click on that middle button, you're going to see these 3 memberships. The other one is the All Access Fitness membership. It's $22 a month. It gives you access to both of our MoveWell facilities, as well as the 2 student facilities, the Johnson Center and Alumni Gym. So 4 fitness facilities for $22 a month, plus all the group fitness classes as well. So that's a great, great benefit also. And then finally, the third one is our virtual membership. So you can literally be anywhere in the world and still participate in MoveWell Fitness. It's $5 a month, and so that gives you access to our live virtual classes. And when I say live virtual, that seems a little confusing. So we have classes that meet on Zoom at a regular time and day, a synchronous class where you're going to be introduced there, and they're going to be like, "Hi, welcome to my class." Right, and so those are synchronous, as well as our virtual library. And I keep about 40 different classes in the virtual library at any one time. And so those are going to be cardio classes, strength classes, yoga classes, Pilates classes, all the different sorts of classes. So you can do those on your own time. And the virtual membership also includes a free virtual training session with one of our MoveWell staff, one of our fitness trainers. So $5 a month, really anywhere all over the world, and you can still participate. So I wanted to make sure that you knew about those 3 memberships that are available to you. The other thing that I want to tell you about is exercise consults. So it's myself, and I have 2 other full-time staff that do exercise consults. And so if maybe you do have a special condition, or you're healing something, or you're going to be in a different location and you want to know, what should I do? Now I'm going to be working out at XYZ gym. Then we're happy to work with you. Every consult is different. There are no 2 the same. Maybe you have a really specific goal. I want to run a marathon in my retirement. Or maybe you say, I've just had shoulder surgery. Now I need to know what I can do that's safe. I've been cleared. And now you're moving on to the next thing. So it can really run the gamut of all of those different things. So come see me. I'm happy to do it. I can do it on Zoom. I can do it in person. We can do it over email. Some of them do it over the phone. So we do have those options available too. So very individualized and one-on-one. And then the last thing that I want to talk about is MoveWell Rewards. Also a program that you can participate in anywhere that you are in the world. If you wear a device on your arm that counts your steps, or in your pocket, or have a phone that counts your steps, then you can participate in MoveWell rewards. And so all we're doing is counting steps, and if you make it to at least 6,000 steps, then you're put into a lottery every single month for extra cash. And if you're still working, it's on your paycheck. If you're a retiree, it's right there to your house. So 6,000 steps, we give 3 winners from that category. 7,000 steps, 3 winners from that category. 8,000, 9,000, 10,000. So 15 winners every month. There was a little bit of math there. I see the wheels turning. So a little bit of math. 15 winners every month, anywhere from $200 to $600 extra in a month. So that's always fun to participate. And then we also run extra challenges on top of our monthly MoveWell rewards. So for example, coming up in October, we're doing our virtual 5K. So that sounds kind of scary if you've never done a 5K before, but 3.1 miles is really only about 6,000 or 7,000 steps. So if you already are getting 6 or 7,000 steps in a day, you're doing a 5K in a day already. So register for the virtual 5K and you'll get your t-shirt to go with it that say you finished the virtual 5K. So lots of programs that go on top of our monthly MoveWell Rewards program. And then there are several resources, and I just want to point out this last little column that says resources on and off campus. So there are other resources for movement, for exercise, for physical activity that are not necessarily run through health and wellness. So for example, if you're going to continue to stay on the health plan through Anthem, then they have some health and wellness benefits that have to do with physical activity. If you're going to be around the Lexington area, Walk with a Doc goes on at the Arboretum and at the mall, and you can walk with other physicians, ask questions. It's a casual sort of walk. So there are lots of resources like that on campus and off campus that I wanted to tell you about. So, and this is just our website. So it's not like it's a slide deck or anything. It's just our website, and you can check that out, and all of this information is there. Do you have questions? Here's the deal. No questions means you have to move. Yes, ma'am.
The fitness memberships, if your spouse is not a UK employee, is it still $7?
$9. Yeah. Yes, that was a good question. She said if your spouse is not a UK employee, is it still $9? Yes. So you can get a membership for $9, your spouse can get a membership for $9, so $18 a month, and you both have the membership. Yes, good question.
The $22 cover the virtual classes too, or is that just the, okay?
Yes, the $22 covers everything. So the $9 a month, 2 facilities, virtual classes, in-person classes, all things MoveWell. $22 a month, all access. 4 fitness facilities, all the in-person classes, and all the virtual classes. Yes, it sort of builds and adds up. So yes, good question.
So if you're just doing the virtual only, does that still give you the rewards and all that?
Yes, so they're separate. You can do the virtual membership with MoveWell, which is the $5 a month. You can do that. And you can participate in MoveWell rewards. They're not mutually exclusive. You can do one or the other or both. That's a good question. Yep. All right, then I'm going to invite you to scoot away from the table just a little bit. I hope your breakfast is done. I'm going to help you to digest. You're welcome. So it's just an invitation. You can, of course, decline. And here's the caveat. If it hurts, don't do it. Okay. So all I want you to do is sit up nice and tall. Uncross your legs if they're crossed, if that feels okay to you. Pull your spine up nice and tall. You have there we go. Everybody just got 3 inches taller. So sit up nice and tall. Take a big deep breath. Yeah. And on that next inhale, just take the right arm. Right arm. Open up the rib cage. Let that food come down and digest. Exhale. Let that one come down. Take the left arm up on the inhale. Let that food digest on that side. It's all going to move through. Good. Let's take both arms all the way up. Now, very gently, we're going to twist over the right shoulder, twist over there toward the coffee, very gently. You can let the arms come down. A little spinal twist. Come all the way back up, over to the left side, the door you came in. All the way up, and then let the hands rest on your lap. Now I'm going to ask you to open up the heart and chest so your spine can move in 6 directions. We don't want to lose that as we retire. We don't want to lose that even before we retire. And then round the spine. So we want to be able to move our spine in all 6 directions. And then back up into neutral. Now, food digesting, breath is deeper. You can do that anywhere, anytime. You can do it at your desk, you can do it at your couch, you can do it in your car as long as you're at a stoplight, not while you're driving, please. All right, and then the last thing I want you to do is keep that nice tall spine. Turn the head over to this left corner and drop the chin down. We tend to hold a lot of tension in the neck. Lift the head, turn it over here to this right corner, drop the chin down. Come all the way back up. All right, thank you all very much. I believe you have a break next. Terry's coming.
Folks, we're going to have a quick break. We can try to reconvene at 9:30, give you some more time to talk to the vendors. NPM Group has a giveaway, so if you've not been to that table, you could register for a free iPad. So we'll announce the winner before we start our 9:30 session. And have more breakfast, please.
All right, we'll go ahead and get started with the second part of our retirement morning. Hannah Farmer, Terry Knatzer, and Coleman Simpson are 3 retirement specialist officers who work with you through the planning. They can help check your retirement eligibility, talk with you, counsel you, work through the process, help you coordinate everything for your retirement when you're ready and even beforehand. They are here to talk to you about the benefits that are available once you do retire and show you the prices and the pros and cons of all. And then we also have Travis Albrecht. He is a co-director and licensed pharmacist with Know Your RX Coalition. He's been a pharmacist with the coalition since 2015. Prior to that, he was a staff pharmacist at the Kentucky Clinic Outpatient Pharmacy. He enjoys speaking with patients and helping them understand their medications, both pharmaceutical logic and each logic behind each prescription, as well as how the patient could save money by switching a safe and effective and cheaper alternative. So I'm going to turn it over to Terry.
Well, welcome everyone. We're glad you're here. We have a lot of information to go over about benefits. I promise you there will be time at the end for questions and answers. So we will certainly address any questions that you have towards the end of the presentation. Okay. What we're going to go over with you today is what everyone receives when you retire, what you need to know to retire. We're going to give a summary of the dental, vision, and life insurance plans. We're going to review the health plans if you're under age 65, what that would look like. If you're age 65, that's when Medicare starts, if you're not working, and what that benefit would look like with our UK Medicare Advantage plan. Some retirees will retire and then come back and work through steps or in a post-retirement role. And so we'll discuss what that would look like in that case because it could have an impact on your benefits. Retirees, let's go over what all retirees receive from UK. A lot of free consultations. You met our speaker with CapTrust, and we also have Enrich. Those are 2 groups that you could meet with for financial advising, planning, even give you a second opinion on your investments that you have with TIAA or Fidelity. Debt counseling from GreenPath. If you've not met with your local vendors with TIAA and Fidelity, please take the time to meet with them today, because you could have annual checkups with them, which I think is very important, especially when you're getting closer to retirement. And also during these meetings, they can help you understand how to access your retirement funds. You're going to speak with Travis soon. He's going to go over the Know Your RX pharmacist benefit. We're very fortunate to have an elder care program. Not all universities offer an elder care resource and referral program. And if you call them, you're going to talk to another Terry. Her name's Terry Weber. You can have mental health counseling with the Work Plus Life Connections program. And it doesn't have to be a very big concern. No issue is too little or small. So whatever issue, if you're having issues, mental health related, you can have up to 5 free confidential therapist sessions. We have registered dietitians with the wellness program, and a lot more that I'm not covering, but you can get this information on our retirement benefits page. Fun opportunities, fitness memberships, and more with the wellness program. And in the very back table, we don't have United Healthcare with us today, but they have what's called Renew Active, which is a benefit, free gym that you could go to if you're on our Medicare Advantage plan. Every year we have an annual retiree fair. We had one last week. We usually have great attendance. We even offer flu shots for these fairs. A lot of activities from the Osher Lifelong Learning Institute. If you don't know about this group, I'm not sure if they're part of the College of Public Health anymore, but this group, if you're 50 years of age or older, you can participate in a lot of enrichment activities, social events, forums, educational things, but they also travel, hear a lot of great things about the Osher Lifelong Learning Institute. And if you're 65 or older, you can take courses at UK through the Donovan Scholars Program. So one thing before we get into the health insurance and what it costs, we need to know, when do you plan to retire? First off, there's no set retirement age. UK defines early retirement is when you're not yet 65, but you do have to meet 2 criteria for early retirement. One is your age plus years of service have to equal 75. You also have to have 15 continuous years of employment with no breaks. If you're staff, you're required to give a 90-day notice. Faculty are asked to give a semester's notice. When you're 65, that is defined as normal retirement. That's usually when most people think of retirement, around that age. And just by being 65, you're eligible for normal retirement. Staff are required to give at least a 30-day notice. Phased retirement is something to consider prior to retiring. We're going to talk more about that on another slide. But you can have a phased agreement up to 3 years. But to make that, or to request that, you do have to be at least 60 years of age and have 15 consecutive years of service. To have an accurate understanding of what benefits you're eligible for, when you're eligible to retire, really you should check in with our retirement office. Let us do a service check for you. If you're not sure when you're eligible and what benefits you can have, this is a good way to get started to learn about that. And then, of course, if you're ready to retire, you could schedule a meeting with us. We'll make sure we've done a service check for you and go over the benefits, and we'll personalize it with you during that meeting so you understand specifically based on your date of hire, your years of service, when you became eligible to retire, what benefits you have. So these meetings are most helpful, I think. And we have a general retirement email, which is retirement@uky.edu. It reaches all 3 of us, and we respond to you. It's probably the best way to get in touch with us. More about phased retirement. I think this is a great program. It's certainly a way that you could ease into retirement if you're not quite ready, but you're ready for more flexibility. This might be a program that interests you. If you are approved for a phased retirement agreement, you're going to reduce your FTE, which reduces your salary. Your FTE has to be no less than half-time, but no more than 80%. The perks of a phased agreement in our eyes, you're a regular full-time employee because it doesn't impact your benefits in any way, except your salary, of course. Your contributions for the retirement match, they do continue, but at a percentage based on your salary. If you need to tap into your retirement monies while on a phased agreement to supplement your income, you're going to be able to do that. You just have to let us know in retirement that you want to do that. Your department, not HR, grants phased retirement, and this is very important that you know that because often people start with us. Really, it's a conversation that you need to have with your supervisor first because not all positions are suited for phased retirements. So if this is something that interests you, certainly have that conversation, and you could follow up with us in retirement if you have questions. But we will help we will help you with getting the approvals in place if it is supported at the department level. Don't get overwhelmed by that agreement because there's quite a lot of signatures on that second page, but we really work closely with your payroll areas on helping you get those approvals if it's supported at the department level. A little more about early retirement and these requirements. So as I stated earlier, for early retirement, you have to meet the rule of 75. That age plus years of service have to equal 75. Your years of service have to be 15 years in a position with 100% FTE. Your FTE, if it's not 100%, you're going to have to work longer to achieve that 15 years of service. 15 years working in 100% FTE is equivalent to 20 years working in a position if you're a 0.75, for example. Those years of service have to be continuous with no interruptions, and those years in a regular position. So temporary on-call positions, they do not count towards retirement years of service. Also, if you've had a break in service that's been more than a year, unfortunately, we have to go by that most recent hire date. But your other prior years of service can be helpful because that would go towards your total years of service that could help someone in terms of like that age service matrix that you'll learn about when we get into the healthcare costs.
Can I ask a question?
Yes.
Before you turn the page? Some of us were deferred during COVID. Is that going to cost us a problem if we were displaced or because of COVID?
No, that's a good question. So during the COVID, if you were displaced, you were not separated. I think they coded it as a like a leave of absence maybe, or like a leave. Whatever it is, I know that those positions were not a separation, if that makes sense.
It kind of clarifies something.
Yeah, and you're welcome to reach out to us just to have us visually see it and how it was coded in the system, just to kind of give you some peace of mind on that.
We came in March and they told us we're not going to be needed from April till July 1st.
Okay.
So we were sent home and we got
Right.
unemployment for that period of time.
Right.
So
And I'm 99.9% sure that you were not separated. Yeah, so you'd be fine.
thank you.
Okay. More about normal retirement requirements. Like I said earlier, you just have to be 65 years old. Regardless of your years of service, you will qualify for normal retirement. For access to the health coverage, when you're 65, you do have to have at least 5 continuous years in a position with 100% FTE. For the health subsidy, you have to have 15 consecutive years in a position with 100% FTE. If your hire date was prior to January 1 of 2006. I've already talked to someone in here that was hired after 2006. You would be eligible to retire at 65, but you would want to have that, at least that 5 consecutive years to have access to benefits. We'll get more in depth in that in some upcoming slides. Again, those years have to be continuous with no interruptions, and those years have to be in a regular position. Again, temporary positions, they do not count towards retirement years of service. Often people have questions when they come meet with us about their unused sick leave and what can you do with your sick leave? Well, if you have at least 66 days there, you were hired prior to July 1 of 95, you can convert that to a financial payout. And that financial payout would be 22 days paid at your hourly rate. Those remaining hours after 22 days paid at 10% of your hourly rate. So that could be a pretty nice payout on your final check. If you did not want to use the financial payout and you wanted to retire much earlier, maybe you're not eligible to retire yet, but you have enough sick days there to convert them to move your retirement date much earlier. And these are things that we would look at for you if we had a personalized benefits meeting to help you determine what would be best given your goals and when you want to retire, if you could benefit from moving your retirement date up. If you were hired on or after July 1 of 95, you can convert those days to move up your retirement date, as I stated with the other, but also to add to your years of service. There was someone a couple of years ago that had, so many sick leaves days. It was way over 66 days, I think probably 4 months, or maybe even 5 months. And they wanted to retire early. They were eligible, but they were in their age service matrix for premiums. So they were able to use those TDL days to get them up to 25 plus years of service so that their insurance is much lower. Again, something that we would be talking to you about if you were ready to retire and you were trying to, if there was anything that you could do with your sick days to benefit you for a lower cost. Okay. Unused vacation leave can be paid out at retirement up to 1 year's accrual. As you get closer to retirement, check your vacation days to make sure you're able to use days if it's above your annual limit. When we have a benefits meeting with you, we will estimate not just your sick payout if you're eligible for that, but also your vacation time. We would look at that, give you an estimation of what that might look like on your final check, because if it's a significant check, you could actually tax shelter the payouts and put that into a retirement account with TIAA or Fidelity in one of their voluntary plans. So we can help you kind of understand that a little bit better and tell you what you need to do to make that happen. Life insurance. We all get basic life insurance, no cost to you, 1 times your salary. That will end at retirement. We do have other life insurance options. So if you've been purchasing optional life insurance at 1, 2, 3 times your salary, that is through Prudential, and we would give you information to call them about a conversion deal. It's a conversion for term life insurance, and the group discount would go away. Not that attractive when you retire. NPM Group does offer a different type of life insurance. It's universal life insurance, which my understanding has a cash value. That life insurance can be ported. You could take it with you at the same cost you're paying now. Really, I think anybody in this room, if you have life insurance, it's really good idea to look at all the insurances that you have for life insurance, determine how much you need in life insurance, because I have just met with so many people over the years that really had way too much life insurance. And so really think about how much you need And that might help you decide what to do if you are paying into optional life and you have a universal life insurance plan. Okay, I'm now going to turn it over to Coleman. He's going to get more into the cost of the health insurance.
All right, so good morning, everyone. Thank you to Terry for telling us how to retire and when we're going to be eligible to retire. Let's talk about now what your benefits are going to look like once you retire. And so first, there's a couple of different things that you really need to think about in determining what your eligibility for health insurance, dental, vision is going to be, and what your premiums are going to be on that. So there's really four main things that you're going to want to consider. When were you hired? Were you hired before or after January 1st, 2006? When you were going to be retiring, how many years of service, what is your age going to be when you retire? These are all things that can play a pretty significant factor into what your premiums are going to be. And then finally, you want to consider, are you going to be returning back to work in UK in a part-time position? Because that can affect your premiums as well. So I am going to say, I am going to cover a lot of information in a very short amount of time. So if you have any questions about what the rates are going to be, what the premiums, you can find a lot of this information on our website. It's listed up here. In addition, you're more than welcome to email us at retirement@uky.edu. We can always set up a meeting, especially if you're getting close to retirement, to think about what your individualized circumstance is going to be. So first, let's talk about dental and vision. So for the dental and vision plans, the requirement is that you have to have at least 5 years of continuous, regular, full-time service in order to be eligible for those plans. Now, as far as the dental, specifically, the UK dental plans, some of you are maybe familiar with the UK Dental Basic, the UK Dental Comprehensive. They do not offer those plans in retirement. However, they do offer two similar plans, the UK Dental Classic and the UK Dental Ultra. They're fairly similar to what it is as an employee, but you can find more information on those specific plans on our website as well. If you have one of the Delta Dental plans, good news, it's basically the same plans that you have right now as an employee with the same rates and the same coverages. So if you have one of the Delta Dental plans, it's what you're familiar with. Likewise, with the Vision, it's much like the Delta Dental, same plans, same rates. So if you have just you on there, it's going to be around $850. If you have, a spouse on there, it's going to be around $16, family, and so on and so forth. Now, there are sort of three different categories of health insurance for retirees. The first is for people who retire under that early retirement category who are under age 65. And for the most part, you're going to be looking at the same plans that you have right now as an employee. So if you have the HMO, you see the exact same HMO. If you have the PPO, it's the exact same PPO. The only difference is going to be the cost, and then of course that's affected by your age, your service, and then the date that which you were hired. If you retire after 65, or when you turn 65, you are eligible for our Medicare Advantage plan. Again, premiums determined by your hire date and age. But that is the plans for over 65. We'll get into that a little bit more here in a minute. And then finally, if you return back to work at UK, you will be eligible for our employee health plans, and then you may be eligible for a discount on those plans, again, based on your age and your date of hire. So let's talk a little bit about the early retiree plan, so anyone who's under 65. If you were eligible to retire as of 7/1/2007 and you were hired prior to January 1st, 2006, your rates are going to be listed up here. And so if you meet the qualifications for early retirement, the age plus years of service with the 15 years minimum, as of July 1st of 2007, then this is what your rates are going to be, and you're looking at a flat cost. Rates do, of course, increase based on the plan that you choose, and then how many people that you're going to have covered. Now, if you were hired prior to January 1st, 2006, but were not eligible to retire as of July 1st, 2007, you're going to be in what we call the age service matrix. And you can see sort of the rates up here on the top right in the orange. So if you have, 64, if you're age 64 and you have 25 plus years of service, you're going to be on the lower end of that bracket. Whereas if you were retiring under age 60 and had only 15 years of service or 18 years of service, you're going to be looking at something in more of the higher category. If you're looking at here, like that's a pretty big difference between $159 and $2,271. We'll get into that in just a minute. Now, if you were hired after January 1st, 2006, you are unfortunately not eligible for the health credit, and so your rates are on the left here. You're still eligible to participate in our plans, but you do have to pay the full cost of the premiums. And so let's look a little bit about how those age service premiums are going to break down. So you pay a percentage of the full cost based on your age and your years of service at the time of your retirement. Again, if you were hired prior to January 1st, 2006. So let's say you were retired at age 57 and you had 18 years of service. You pay approximately 80% of whatever the full premium cost is going to be. If you were 64 and had 25 plus years of service, then you only end up paying 15% of that premiums. Now, if you notice on the bottom, it says there, everyone 65 plus pays 10% or $19. That's our Medicare Advantage plan. We'll get to that in a minute. So to give you some more concrete examples, because looking at percentages isn't particularly helpful sometimes, this is what your rates are actually going to look like, at least for the 2023-2024 fiscal year. So again, let's take the same scenario. You're age 57, you're going to be retiring with 18 years of service. We're looking at approximately $801 per month for your HMO. Again, if you were 64 and had 25 plus years of service, then you're only looking at $150. And as Terry mentioned previously, you can convert some of your TDL time into years of service, which is really great if you're on the cusp of moving in between that 24 to 25 years of service, because you're looking at a couple $100 difference worth of premiums. Now, one thing I do want to mention here, these rates listed on the chart here, these are for the retiree only, so that is for you. It does not include any family members. If you do want to include a spouse or any children, there is an additional cost for that. So if you want to add on a spouse to the HMO, you're looking at an additional $984 per month. If you're going to be covering a spouse or children as well, you're looking at an additional $1,470 per month. So they can be fairly expensive. So next, you're looking at the PPO plan. More or less the same information. If you're retiring less than 60, 15 to 19 years of service, you're looking at $812. If you're going to be adding on a spouse, it's an additional $999. If you're going to be adding on a family, it's going to be $1,489 additional. And then finally, the RHP plan, again, $847 if you have less than 60 with 15 to 19. If you're going to be adding on a spouse, it's $1,044. If you're going to be adding on a family as well, it'd be $1,572. So let's talk a little bit about our Medicare Advantage plan. So if you retire and turn 65, or if you retire after 65, again, you are eligible for our Medicare Advantage plan. But Medicare can be a little bit confusing. You'll hear people say, oh, well, you need a Part A, you need Part A and Part B, but you also need to pick up a Part C, and don't forget about Part D. And if you're not really well versed in it, that sounds like a whole bunch of nonsense. But I'll explain sort of what these are. So Part A is typically hospital insurance. So if you have an emergency, this helps cover for hospital. Part B is medical insurance. So that's seeing somebody on your doctor plan, right? Part C is a supplement plan that helps pick up some of the stuff that A and B don't. And then Part D is typically prescriptions. Now, Part A is basically free for most people. There are some circumstances where you may have to pay a premium, but typically for most employees, we do recommend that you sign up for Part A when you turn 65 because it's free. So there's really a reason not to. Even if you're working at UK still, we still recommend that you sign up for Part A because, you know, it's a free benefit. Now, Part B, however, that does have a premium associated with it. That starts out at $165 per month and increases based on your modified gross adjusted income from 2 years prior to you enrolling in Medicare. Now, I know that's a long mouthful. So think of it like this, right? If you were going to be retiring in 2024, they're going to look back at your 2022 taxes. Based on what your 2022 taxes are, is going to determine what your Medicare Part B premium is going to be. Now, Medicare Part C and Part D are typically covered by our Medicare Advantage plans. There are some circumstances, especially in higher income brackets, where you may have to enroll in Medicare Part D. But for the most part, our plan covers Part C, and it also fills prescriptions through Express Scripts, which covers Part D as well. So Medicare Part A and Part B is required for our plan, and it's generally required by the government when you turn 65 and if you are no longer working. There is a stipulation that if you are still working and are getting an employer-sponsored health plan, you're covered by that, such as the HMO. You don't have to enroll in Part B if you're still working. But if you are no longer working, you're fully retired, you do have to pick up Medicare Part A and Part B, and it is a requirement of our Medicare Advantage plan. And so the way that the billing sort of that works, right, is Medicare Part A and Part B typically covers about 80% of the total cost, which means that if you just have A and B, you are left with that other 20% to pay on your own, which can be pretty expensive, which is why a lot of places recommend that you pick up a Part C plan or pick up our Medicare Advantage plan. As far as your eligibility for the Medicare Advantage plan, you can see that on our basically on our website, what the premiums are, what it covers, and as well as you're going to be actually eligible for that plan, you can always contact us to figure that out. Now let's take a look at the premiums here. So, if you were hired before January 1st, 2006, and have at least 15 years of service, so you're eligible for the credit, you pay the column on the right here, so $19 per month, so the column in the orange. If you were hired after January 1st, 2006, or if you have less than 5 years of service, but more than 5 years of service, so between 5 and 15, you're eligible for the information on the blue. You're still eligible for our Medicare Advantage plan, but you have to pay the full cost of the premiums. And unfortunately, if you have less than 5 years of service, you're not eligible for any of our health, dental, or vision plans. So, you may have mentioned, I said that our Medicare Advantage plan will pick up a portion of what Medicare Part A and Part B doesn't. Expounding on that here, it works in tandem with Medicare to provide an additional 16% of coverage. So Medicare A and B provide 80%. We covered an additional 16%, which means that you are left to pay 4%. Now, if anyone is familiar, you have the PPO plan or the high deductible plan, you're probably familiar with deductibles. You pay that deductible once per calendar year. It's $185 on the Medicare Advantage plan for 2023. And then once you've met that $185, your cost of your services are generally 4% after that. So, for example, let's say you had to go and have a procedure done. It cost you $1,000, right? That's the full cost of the bill. Medicare pays approximately 80% of that. You pay $185 out of pocket, and then you pay 4% of whatever is left, which would be around $32. And if you ever had to go back to the emergency room again, or if you had to go see another procedure that was like $1,000, then you end up paying only $40 because you've already met your deductible. And again, that resets based on the calendar year. There is also an out-of-pocket maximum when it comes to the Medicare Advantage plan. It's $3,000. That is the most that you're going to pay for medical services over the course of the calendar year. So once you have paid $3,000, then everything after that is covered at 100%. So, let's talk about working retirees, because I remember we talked a little bit about that was the last qualification. So if you return back to work at UK in a STEPS position, temporary position, that's at least 0.2 FTE, that is approximately 8 hours per week, you are eligible for the employer-sponsored plans, And depending on when you were hired, you may be eligible for a credit as well. So if you were hired prior to January 1st, 2006, you were eligible for the credit, and you returned back to work in that 0.2 FTE position, you are eligible for the employee health, dental, and vision plans at the regular full-time employee rate. So for example, if you came back, worked in had like the HMO, and you were just covering yourself, you're looking at the same plan as you would now, about $40 a month. Now, if you were come back to work within 3 months of your retirement, and this is regardless of whether you are hired prior to 2006 or after 2006. If you come back to work within 3 months, you're also still eligible for the employee health, dental, and vision plans for 1 year after you retired. So, for example, let's say you retired on January 2nd until essentially January of 2024 or 2025, you would be eligible for the same health, dental, and vision plans that you have now at the regular full-time employee rate. The only condition on that is you just have to still be employed at UK. And finally, this last box down here, if you are age 65, if you are working that position 0.2 over, you can actually are still eligible for our employer-sponsored plans. You don't have to pick up Medicare plans. So we do have some people who retire and they come back immediately and they stay on our HMO and they don't have to enroll in Medicare because they're still covered by our employer-sponsored plans even though you've retired. And if you have already signed up for Medicare, that may be a qualifying event for you to drop that. So let's talk a little bit about the actual rates themselves. So as I mentioned, if you did like the HMO for just employee only, you're looking at $40 a month. Now, when it comes to those working retiree positions and premiums, that only covers you. It does not cover a spouse. It does not cover any children. So you have to pay their portion at full price. So that's why it's $999 because you get the credit towards you, but your spouse and children don't benefit from that credit. So you do have to pay a little bit extra for them. And again, if you returned back to work, you were hired after January 1st, 2006, and you did not return back to work within 3 months, then you're looking at the full cost of the premiums for the employer plans, and that's found on the left here. Now, if that seems a little expensive, but you still want to work at UK, you can, as long as you're in a position that's 0.19, so 19% FTE, approximately 7 hours per week, you are eligible to stay on the retiree plans. So what that means is, let's say you had you and your spouse on there and you really didn't want to pay, $700 a month. If you, as long as you were working 7 hours or less, you could stay on the retiree health plan and still be working at UK. So that is an option for you as well. So that is the bulk of our questions on insurance. I have our contact information up here. If you have any questions about eligibility towards retirement, health insurance, feel free to give us contact. Our numbers, you can contact our customer service team at 257-9519, or you can email us at retirement@uky.edu. And if you have any questions on our retiree billing or anything involving medical insurance, you can contact Jennifer Hobbs or Debbie Martin. So now I'd like to introduce Travis Albrecht. He is with the UK Pharmacy Benefits, and he'll go a little bit more about what your plans are going to look like as far as prescriptions.
Thank you, sir.
Can everybody hear me okay? Thank you very much, Coleman, for the overview on eligibility and everything. As he said, my name is Travis. I'm a pharmacist here with University of Kentucky. Work in the prescription benefits department. So a lot of our stuff has Know Your Rx on it. We are UK employees. We help administer the UK prescription benefit. We're currently working with the active employees, the pre-65 retirees, and the post-65 retirees. So your commercial plan and your Medicare plan. We're here to answer your questions, concerns. If you want to talk with a pharmacist, if you got questions about coverage or cost or anything, we're here to answer those questions. We're pretty intimate with the plan, so you can call with your specific drug questions. Here's our contact information. If I do not answer a question you have today, or if you have a question that you want to talk with a pharmacist in confidential manner, please feel free to reach out to us. We're there Monday through Friday, 8 a.m. to 6 p.m. and closed on the weekends. So there's kind of two different branches where everything falls. There's, like I said earlier, the pre-65 retirees in the commercial plan and your active employees, and the Medicare retirees. That's the A and B participants, and you're no longer working or you're under that 0.2 FTE threshold. Here is an example of what your card is going to look like if you are a pre-65 retiree. You already have one of these already if you're working. This covers you. It covers your dependents, your spouse, your children. They're not named on the card. That sometimes trips people up a little bit. It has the main sponsor. So the main employee, their name's on the card. Your dependents won't have their own card, but they are covered on the benefit, and the pharmacy should be able to still bill accordingly. It's, the enrollment is all administered by Express Scripts and University of Kentucky. So right now with the commercial patients, if you got a dependent added or change an address or something like that, we can update it on the fly pretty quick. Now, when we move over into the Medicare side, that looks a little bit different. Everybody on your plan now is covered under the same ID number, all that kind of stuff. In Medicare, you don't have dependents, you don't have spouses. They can be eligible for insurance through your activities, your employment, your benefits, but they are not on your plan. So when we bring some people up, you'll have your own individual Medicare ID number, your own individual Medicare enrollment information. This stuff works a little bit slower because this all has to go through Center for Medicaid Services. So any updates to eligibility, name, anything like that has to go through Social Security Office, University of Kentucky, Express Scripts, and then it finally gets updated. So things do take a little bit longer to get updated in the Medicare system. And this is a little bit different because if you and your spouse were both previously covered on the commercial plan, you'd have one card, it'd have the employee's name on it, you take that to the pharmacy, and that's how they would bill everything. In the Medicare plan, everybody's gonna have their own card, it's their own plan, it's your own deal. These are what the prescription drug coverages look like on the commercial versus the Medicare plan. In the commercial plan, it's an open formulary, meaning that there's preferred tier 1s, there's preferred tier 2s, and there's non-preferred tier 3s, where everything kind of falls in that tier 3 level that's not covered as a preferred product. In the Medicare plan, it is a closed formulary, which we just got those formularies for 2024 today. So if you do have questions about something that's covered next year on the Medicare formulary, we can now answer those questions. So that's exciting. And where that medication falls kind of hits in there. Percentages, as we talked about earlier, are not really useful because who here knows how much a drug costs? It would shock most of you, I think. A simple generic can be $3 or $4. A simple generic can also be $1,000. So you can always call, talk to us and say, hey, this is the drug I'm on, what's it gonna cost me next year? If that price is digestible, great, move forward. If not, we can work with you and your doctor to help, hey, this is a medication in the same class, this is safe, effective, and affordable. Because if a drug's not affordable, if you can't take it, it's not effective because you don't have it. Some more differences on the Medicare versus the active retirees, or the retirees or the Medicare plan. You're limited to 90-day supply right now through Express Scripts Home Delivery or the UK pharmacies. In the Medicare plan, that opens up quite a bit more. It's not just Walgreens, but that was just kind of an example of your retail pharmacies that are out there in the general public that you can use. Specialty medications, any pharmacy. You're not limited to UK or Accredo, that Express Scripts side of mail order. Healthcare reform has had some impacts on the commercial plan. So the Affordable Care Act, $0 vaccines, long list of $0 vaccines, highly encourage people to take advantage of that. If you ever have a question, we had a big overhaul with the HMO plan, moving everything to the prescription drug benefit. So you don't have to go to your doctor's office to get your flu vaccine. You can go to the pharmacy. That was a big step for, I think, last year is when we made that change. So if you ever have a question about vaccines, those are covered. Healthcare reform not necessarily impacted Medicare. It was the Inflation Reduction Act, the IRA, which had a huge impact on Medicare. And now there's a long list of Medicare Part D vaccines that you can get at your pharmacy. Biggest one of note, RSV vaccine. That's the one that's made the most news. You guys can get that at the pharmacy. And I have information in a little handout of which card to show when, because it can get confusing there, but that is covered under Medicare D. Stay safe. Pharma copay cards, that's the second biggest impact for you guys. First biggest impact is if you're in the Medicare plan, the UK pharmacy won't be able to offer that 50% up to $60 off discount. That's a discount that they've offered over the years. When you're in Medicare, it's just the way their acquisition pricing and things like that, their contracts, they can't offer that discount to Medicare enrollees. Second thing is you can't use copay cards. And the reason for that is, we'll get into a little bit with the donut hole, the coverage gap. Pharma is paying, they're already subsidizing cost of drugs, so they can't pay on that side and the copay card side. So that's a good thing to keep in mind. Copay cards and the UK discount do go away when you move into Medicare, but the copay structure, that could be non-impactful depending on your drug mix. Diabetic testing supplies, big thing. They're covered under the RX benefit and the medical benefit now. It'd be covered under your Medicare Part B card when you move into Medicare. Nebulizer solutions, some oral anti-cancer medications. It's just a big discrepancy on if something is Medicare B or D. Here's the list of the vaccines that are covered: flu, pneumococcal, hepatitis B, COVID vaccine. These are all covered. Right now, it's not as clear. It was kind of cut and dry probably a year ago, but with the IRA coming into place, while it's a little bit more confusing, you still have more access to $0 vaccines. So it's a good thing. If you have a question, give us a call. Say, I want this vaccine. How much is it going to cost me? What card do I show? We'll be able to direct you. Vitamins and minerals, not covered on Medicare. Cough and cold, Medicare, it's an excluded category. So, your Express Scripts Medicare Part D. This is a Medicare Part D plan, which means that it's subject to all the Medicare, CMS, Center for Medicare and Medicaid Services, CMS rules and regulations. We have a formulary that we follow. UK does not design or build this formulary. This is a formulary that has to be submitted to Medicare. Medicare has to give its blessing on it with all the different rules of formulary development. This is kind of the best illustration that we can do for the standard Medicare plan. And this is to show, the standard Medicare deductible is $505. Then you move into initial coverage, where you pay 25% of the drug cost. Up here in the coverage gap is where I was talking about that pharma discount, that 70%, where pharma, so Pfizer, Lilly, all those drug companies, they're paying 70% of your drug cost in that situation. That's why you don't see copay cards being used. And then you move up into catastrophic coverage, and for 2024, if you make it to catastrophic coverage, you have $0 out of pocket. It's going to change again in 2025, but for now, just kind of think of it like in the commercial plan, you have a maximum out of pocket that once you reach it, you have $0 cost. It's the same kind of idea in Medicare at this moment. Once you hit catastrophic, you have no more cost if it's a Medicare D covered product. But this is the standard Medicare benefit, and UK offers an EGWP, which is an employer group waiver program, that Medicare Advantage plan that UK offers. It has to be better than this in order to offer a plan. So we have no deductible for the UK prescription benefit. You show up to the pharmacy, you're immediately in the copay structure. And then you start moving through the different benefits. And we have 20% coinsurance on those tier 1 generics, no minimum. Moving into the coverage gap, it stays 20%. You don't have to go up to 25%. We encourage you to call us whenever you have questions about medications or costs or coverage, because while your cost will reflect having a 20% coinsurance, if you call Express Scripts or call somebody like that, they're going to say, oh, you're in the coverage gap. And that doesn't really answer your question, because while technically you are in the coverage gap, it's not a reason for your copay to be what it is. So we can help dig deeper and figure out exactly why your drug is pricing the way it is if there's an issue. No deductible, complete coverage through the donut hole. These are some of the past numbers, and it's the weirdest math you'll ever see, because moving from the deductible is all your cost. The initial coverage is what you pay and what UK pays. And then to get out of the coverage gap, it's what you pay and what that 70% pharma pays minus whatever UK was paying. So it's all these different buckets. I wouldn't expect anybody to keep up with it, but these are the kind of numbers that we hit. In 2024, that catastrophic coverage, when you go to $0 cost, is $8,000. Now that $8,000 is what you pay and what pharma manufacturers pay. So it's kind of hard to predict, what am I going to pay? Just your average drug mix. We'd have to look at it and see what drugs you're on, how many brand drugs, generic drugs, to see how you would get there. That's all going to change in 2025 with the IRA, Inflation Reduction Act. But for now, in 2024, if that magic number hits $8,000, your cost goes to zero. Here's a somewhat decent example that illustrates the pharma contribution. So initial coverage phase, total cost of the prescription is $3,000. Member copay of $60, pharma contribution $0 in that initial phase. So you got $60 of credit. Once you move into the coverage gap, now pharma's paying $2,100. You only paid $60, but you got $2,160 of credit. So that's how you can move through that phase rather quickly. That's a 1-month prescription. You get that filled 4 times. You're in the catastrophic phase. Boom, you go to $0 the rest of the year. So $8,000 seems scary, but when it looks something like this, it gets there pretty quick. It's scary how fast you get there. We've gone over a little bit with this with Coleman. Sign up for Medicare Parts A and B within 3 months to your 65th birthday if you're moving into Medicare. So definitely sign up for A. Like you said, it's free. The B is a little bit more subjective. Complete UK Merit. Work with all them to get with the Medicare Advantage plan. We send a file to Express Scripts, who sends it to Center for Medicaid Services for processing, and then they approve it, and then it gets in. So that's kind of that rigmarole I was talking about earlier. If things do change, eligibility, it does take 3 or 4 days for this stuff to get squared away properly. When CMS approves, you get a packet and an ID card. These packets show up, they're nondescript, it's a big wide envelope, you might throw it away. So if you're retiring, my suggestion is to open all your mail, because we get a lot of calls that said, I didn't get anything. And I was like, I'm sure that went straight to the trash, because you're gonna get 1,000 different offers from 1,000 different Medicare groups telling you, sign up for our plan. It's scary because every one of them looks legit. And be aware, because if you sign up for another Medicare plan, it will kick you out of ours. So my advice would be to reach out to UK. If you do elect to be in the UK Medicare Advantage plan, reach out to them. Hey, is company XYZ, is it legit? Is it somebody you partner with? Is it somebody you vendor with? Is it somebody that we can work with to help our retirement? If not, be leery. Okay. Yes?
Is the UK Medicare Advantage plan offered, is it, if I retire at 55, I'm not signing up for Medicare Advantage?
No.
When I get to 65, even if it's been 10 years since I retired, I'm still eligible for UK Medicare Advantage?
If you're eligible for the plan and everything, yes.
Does that make sense what I'm saying?
Yeah. So basically, if you here. So basically, the way that works, the question was, if someone retires at 55, are they going to be eligible for the Medicare Advantage plan when they turn 65? The answer to that is typically yes. So whenever you retire, if you decide not to continue with our health plan in like early retirement, yeah, you can defer one time and then come back onto our plan when you're 65. Just know that if you're coming on to our plan after age 65, you will need to provide proof of at least 1 year's prior health coverage and then proof of prescription coverage since you turned 65. If you have been on our early retiree plan since you retired, then you can automatically just go over. You just need to fill out a quick form and provide us with a copy of your Medicare A and B cards. Does that make sense?
Excellent, thank you. This is an example of a Medicare explanation of benefits. You will get one every month explaining how you've used your Medicare Part D. Sometimes it'll be blank if you haven't used it at all. It'll be multiple pages if you've used a lot of it. This is something that you're gonna receive. It's a CMS requirement They have to send these to you. You can also find them electronically. I'm going to assume that within the next 5 to 10 years, they're going to be all electronic only. So this is a requirement that you will get in the mail if you are on the Medicare plan every month. Late enrollment penalty. Now, this is something to keep track of. If you work past 65 and you're eligible for Medicare when you turn 65, but you're still working, so you're staying on the UK commercial plan, and you're moving along, you're working, and then at 68, you're ready to retire. You had 3 years when you were eligible to be part of the Medicare plan, but you had credible health coverage. If you go enroll in Medicare, it could get overlooked and they charge you a fee because you signed up late. It's like saying, I'm going to wait till I'm sick to sign up for insurance. That's how it's kind of viewed as. You may get a late enrollment penalty letter. If you've had coverage, if you've had health insurance, and it's been through UK, we can attest for you. It's called a letter of attestation. We can do all of that. We can submit it to Medicare saying, hey, John Doe had insurance through us through these dates. He's good to go, no late enrollment penalty required. If you have a spouse who didn't get on the plan until they were 68, either because they had insurance or if they didn't, they'll pay the late enrollment penalty, but if they did, they'll get a letter as well, and it's a simple attestation of saying, I've had health insurance, it was credible coverage, I'm not just waiting till now to sign up. So that's something to be on the lookout for. It's a small fee, but it adds up quick. It's 1% of the premium, but they add it each month, and that's just an extra fee that you don't want to have to pay if you had coverage. IRMA, so your income-related Medicare adjustment amounts. These are based on your 2 years previous tax filing returns, and if your income was at a certain threshold, then your Medicare premiums would be increased based on these thresholds. They haven't published the ones for 2024 yet. They may have published them last week. I was out, but this is kind of that sweet spot of Medicare publications time. So these are kind of ballpark numbers at the moment of what your earned income is if you could expect to see Medicare adjustment amount.
So Travis,
Yes, sir.
Is that adjusted gross income?
Yes, it is the adjusted gross income. Yes. And then on the opposite end of that is the low income subsidy. So if you think that you qualify for extra help, if your income is on the opposite end of that spectrum, and you could receive breaks on premiums or in some cases reduced copays, it's at the bottom of the screen here, ssa.gov. They have a very well laid out website of how you can determine if you do qualify for extra help on there. Hospital observation and ER visits. This is something that you don't know to anticipate it until it happens to you. You go to the hospital and you get admitted. Well, you think you're admitted. You go to a hospital room. They give you medication. They replace your knee or they take your appendix out. But for whatever reason, that wasn't classified as an admittance. You were under observation. We see this way too often. And if you get, let's say you're on a statin medication for your cholesterol, and while you're there, they give it to you 3 times. They try to bill insurance. Insurance says, no, you weren't admitted. You were under observation. So then they send you the bill for the medication. The hospital can't bill Medicare Part D, but that needs to be covered under Medicare Part D. You can get in touch with us. We can help submit all the paperwork for you and everything to make sure that gets submitted to Medicare Part D so you're not out an outrageous amount of money for 3 days worth of oral medication that you just take regularly. This is something that we try to warn people about. We hadn't seen a whole lot of it until about 8 years ago, and then it's really kind of seen an uptick of people not being admitted to the hospital. We've submitted some papers and stuff to CMS trying to get these things kind of looked at. I think it's a gap in the system that's just been overlooked. But if you ever see anything like that, like self-administered medications, non-admittance, observational stay, you can always reach out to us and we can help you get those Medicare Part D drugs billed appropriately so you're not hanging out to dry on those. Oh, backwards. So here's kind of the Medicare review. There'll be a test later. So here's the summary of it. Enroll in Medicare A regardless of employment, 3 months to your 65th birthday. It is free. Go ahead and sign up. Plan resets 1/1 regardless of when you enroll. So if you enroll October of 2023, your plan, all your accumulators reset 1/1/2024. So just something to keep in mind. It's not like the UK plan is on a fiscal year, so July 1 is when the plan resets. It's always 1/1 for Medicare. That's when everything resets. Low income subsidy can help with if costs are too high, premiums are too high. Late enrollment penalty. Make sure you're on top of that. If you get a letter requesting an attestation, that you reply to it or reach out to us. We can help out in some of those situations. IRMA, that could show up on your premiums. You can always challenge it as well, because if you retire this year and you're making quite a bit of money, that's going to have a dramatic effect when you go into retirement and you're not earning that much money anymore. So it can be challenged. I'm not sure the details on how to challenge that or if it's viable, but it can be. Explanation of benefits, those will start showing up every month. Self-administered drugs. If you get a rejection for those, reach out to us. We can help you do all the paperwork for that. We love doing that paperwork. Coverage gap. If anybody tells you your cost is because you're in the coverage gap and don't worry about it, give us a call. I'm not saying don't believe them. You could be in the coverage gap, but that's not a valuable excuse for why it is what it is. There's a different reason for that surprise cost. Catastrophic coverage, next year, when you get there, it's going to be $0 cost. Vaccine coverage, I've got some information back there in the back that shows which one's covered on which. They should be $0. And if you have any questions about your medications, cost, coverage, anything like that, we're very intimate with the plan. We're UK employees. Give us a call. Call the number. You just let it ring. You can press 1 to leave a voicemail, but if you just let it ring, a pharmacist is going to pick up the phone. So here's some more of our information if you want to take a picture. I know some people were snapping some shots. But any questions, any burning questions anybody has about prescription benefits and KYRX? All right. Yes, sir.
Yeah, on one of the earlier slides, you said that if you're a current employee, you're not retired yet, that it will help pay for vitamins and supplements. How, I mean, is that over the counter?
There's
Is there a
not many.
form?
It's just, that was more to illustrate that in Medicare, vitamins and supplements are not covered. Kind of like cough and cold are not covered under Medicare. Medicare has a little bit tighter formulary restrictions and stuff and whatnot. I think like the biggest thing is like, there's certain like prenatal vitamins and stuff that are going to be covered on commercial that we're not going to see covered on Medicare. So, excellent. Thank you all for your time. It's all yours.
Hi, everyone. So does anybody have any questions about our benefits in general? There's a question right here.
Previous speaker about the age service matrix.
Okay, I'll be happy to assist you.
So, so I understand that 25 years of service is what you're trying to get to, and 65 plus. So, if someone worked part of those years at 0.8 FTE, I assume it's prorated for
It is prorated,
service.
so it's based on. You may have saw the slide that Terry presented on where it was 75%. So where it was 20 years of service, they only got 15. So there in those few years, we will be prorating that based on an 80% FTE compared to 100.
Okay, so someone over there at 0.8 would have to work more years to meet the
Correct.
25. Okay, thank you.
But you could use your sick time to move that up.
Not sure faculty have sick.
Yes, Ward?
Just clear up, I guess, if you're working at 65, the Part A, Part B.
So if you are still working, we encourage you to enroll in Medicare Part A only. It is your hospital insurance and it's free. You are going to get all these mailings saying you're going to be penalized, you're going to be penalized if you do not enroll during your 7-month window. If you are still working, we will help you enroll in Medicare Part B so you're not penalized. We have applications in our office. So once you submit that letter of intent to retire, we will give you and or your spouse a Medicare application that you can present to Medicare with instructions. So we'll make sure you're not penalized.
phased retirement affect that at all?
Phased retirement does not affect that at all. We still see you as a full-time employee under phased retirement. And I do want to let you know that these slides will be emailed to you so you can have them for records. Quiet group today. But if you need any contact information, myself, I'm Hannah Farmer. You probably met with a couple of you in here. We have Coleman Simpson and Terry Canancer will be happy to assist you. We can meet in person, Zoom, phone call, however you would like to meet. We are actually not located on campus. We are located at 23 at 65 Harrodsburg Road, and we're in Suite A250, so we're in the building before TIAA and like right next to Sullivan College. Behind the pond, yes.
Okay. Before everybody leaves, we have a giveaway, right?
Karen, are you ready?
From MPM. I'll take the microphone. Come on. We'll let Hannah draw. I'll draw it, you say the name. All right.
The winner is Regina Morris.
Yay! Congratulations. Well, thank you all for attending. I don't know what number of year this annual event is. I'd like to say, I want to say it's around at least 20. We've been having it every year, so if you're still around next year, please feel free to come back. And thank you so much for spending your morning with us.